Hello, Dr. Naren. It's my pleasure to meet you. What is the purpose of your trip to China this time?
Well, Rachel, you know that we have Sonablate is in cooperation with Sonacare JV, and I wanted to make sure we work all together to our goal to make use of the Sonablate high intensity focused ultrasound in many places.
So, do you think focused ultrasound treatment technology will bring about changes to the clinical development in China?
I think so because it has already been used all around the world, including China, and with the Sonablade focused ultrasound devices that primarily is using right now for the treatment of prostate, both the prostate cancer and BPH, that will help enormously in China as well.
As the world is aging, especially in major cities such as Shanghai, how will the introduction into and localization of sonar blades as well as other HIFU devices in China promote the domestic health industry? Could you elaborate on that?
Yes, the focused ultrasound treatment are called the non-invasive treatment, which requires no incision, there is no loss of blood. There's, because of that, there is not a significant infection either. People can be treated on the same day and go home at the same time, immediately after the treatment. Because of these advantages, I think more and more people are using focal therapy using Sonoblade.
What milestone advancements have been made in ultrasound therapy since your youth to the present day? And what is current landscape of application in the US?
There are many, many applications being explored now. We just started with one application. Right now, over 90 different applications are under research. Several devices are already approved or the procedures are approved by the regulatory bodies, including the FDA. So that's a big change from where we started out with no approved device to many, many approved devices now.
Could you elaborate on the 90 different applications?
Well, we don't have time for all of them, but I'll tell you for the brain, for example, for liver, for kidney, for breast, all these applications being pursued in a very different ways.
Dr. Naren, let's get back to the year when you first got to know Dr. Frank Fry. The world recognizes your great contribution in R&D in ultrasound medical application, especially in tumor treatment. We are curious about how you met the Fry brothers and how did you start the magic journey upon research on ultrasound therapy?
Great question. 1972 is a very significant year in my life. I met my wife in 1972, and at the same time also I met Professor Fry, Frank Fry. And immediately after meeting, the next day I started working with him in a laboratory which he had started for treating the brain cancer patients. So I came to know him in 1972. We worked together for many, many years.
I heard that you share lunch every day, right, back then?
Yes, over 30 years we had lunch together. And even though I was remotely located sometimes because I was working on a breast ultrasound imaging device, he will drive from Indianapolis to Morrisville, which is close to 30 kilometers, every day so we can have lunch together.
Slides show that in 1972 you conducted focused ultrasound research at the Fry Brothers Laboratory at the Indiana University School of Medicine, and together developed the first computer-controlled HIFU device guided by ultrasound imaging for the treatment of cancer. Is it correct? Could you introduce the significance of this project? What does it mean to the world?
Well, 1972 was the year where we had already started a clinical device called brain cancer treatment. And that was worked with Dr. Heimberger, who was a neurosurgeon. And the machine was called Candy Machine because the patient was, her name was Candy. And this device was controlled by a computer, so it was somewhat a robotic device. And we integrated ultrasound images using one transducer and bring the therapeutic transducer exactly the location where the treatment was supposed to be performed. After every sonication, we did the imaging of the same tissue, and we can see the effect at that time.
So the meaning of it is that like what you just explained, or could you elaborate on the significance of it to the clinical area and also?
The significance was that we were able to treat patients, and also there were, of course, the obstacles because at that time we could not go through the skull. But the foundation was laid where we can tell that this technology can work for other applications as well.
Are there any differences in personality and work habits between you and Professor Fry, who you had collaborated with multiple projects for a very long time? Any unforgettable or funny stories that you would like to share with us?
Professor Pai was a very kind gentleman. He was not just a scientist, he also is a very fine, gentle human being. The story about Fry, most popular, is his kindness to share his brain power with others, but more so was with children. He and his wife Marie Fry had adopted 12 children and they raised them. And that was a very fantastic thing to know about Frank. He contributed lots of uh, science and technology in this area, so therefore he's been well known, and with his brother, of course.
I learned that from 1975 to 1976, when you attended the annual conference of the American Institute of Ultrasound Medicine, there were about 10 people who attended the session on HIFU, and it was not until 2019 that you received a Visionary Award from Focus Ultrasound Foundation, and the foundation chairman, Dr. Neil Castle, said that Naren has an excelled experience and expertise in virtually every aspect of the field, from design and construction of the equipment to preclinical laboratory studies, clinical trials, as well as commercialization. How did you persist in such an emerging and relatively undervalued scientific research field at that time? What are the most unique challenges and difficulties you have encountered during decades of scientific research?
Well, like everything else, in medicine, it takes really long time to prove both the efficacy and safety. So first and foremost, you have to have a trust in yourself and in the science that what you are going to perform, because if you cannot explain to other people, that is a more difficult thing to do. So we had to learn very in laboratory using many experiments so we can refine the technology to a point where we can bring it to the doctor and says it will work, and trust me that we will not hurt the patient, because initially there is always a reaction what will happen. So in order for me to stay in the business, I had to continue to learn how to improve the technology. And communicate with most of the outside people and the experts that what this technology can do. And generally speaking, the people have been very kind to me, they listened to me, and they were willing to help me. That's why we continue to work on this, because there are many, many good people who will help you when you explain how good this work can be.
You mentioned that you may be turned down at the beginning because some physicians might not believe the power of HIFU in cancer treatment. So could you share a story or anything fun about how you persuade them into helping you?
So first, for example, in the case of the treating the prostate, our approach was to treat the benign disease rather than the malignant disease and prove that the technology is safe. It's not going to hurt the patient. When that part was done, then there were some doctors who were willing to try out on a cancer patient, what we call very selected patient, and these patients benefited from this treatment. Thereafter, of course, we had to conduct the clinical trials, and many doctors were very much interested in joining us in conducting the clinical trials. And there were some leaders, they were exploring the different ways to do the management of the prostate cancer. And these are the people who are called the leaders in the field, who took the science and the technology and work with us and work with the patients to make sure the technology is utilized properly. And that's why we continue to make progress.
During 1988 to 1992, you and Professor Frank Fry, as well as urologists from Indiana University School of Medicine, developed the transrectal HIFU device. I believe that is Sonablate 100 for the treatment of prostate diseases. What was the opportunity to switch from brain cancer treatment to prostate treatment research?
The first and foremost, the brain cancer treatment was extremely difficult because we have to go through the skull. But in 1984, the first device called extracorporeal lithotripsy or shockwave device came to Indianapolis, and that was in a urology department where they demonstrated that focused ultrasound can be used to destroy the kidney stones using extracorporeal way. That means no incision to the kidney, no blood loss, and the patient can feel better immediately. That particular development has a many significance because it gained the trust of the urologist that transrectal focused ultrasound can be used to treat the soft tissue as well. And that was the switch, because on the brain side, we did not have the ability to go through the skull at that time. And the shockwave device came in town that generated lots of interest, and that gave us the most probably the significant push for developing the Sonablate for transrectal treatment of prostate.
So after Sonablade 100, there are 200 and 500. Could you introduce a bit about the difference between them and how the transition became?
The Sonablate 100, as you mentioned, was developed late 80s, early 90s. The computer power was not available at that time, what significantly changed over the years. So Sonablade 200 was also a better processor, but not very high speed. The Sonablade 500 then came with a processor speed that was very good, and we can produce lots of data, and we can give the images of the prostate in more or less real time on the full scale. And that design then became the standard design for the Sonablate 500, which was introduced to get the regulatory approval in the clinical trials for the prostate cancer.
I've heard that the Sonablade is gaining more and more popularity in the US lately. What do you think the reason behind that?
Well, Sonablate was approved in 2015. Thereafter, the approval, uh, people have to learn how to make use of it, of course. And the reimbursement plays a major role. So now we have the reimbursement that pays for the Medicare patients, for example, and that become available to all the people above 65-year-old. Plus, I think the focal therapy has made a significant progress in localizing early lesions or the index lesions inside the prostate, which is done by the MRI. So our device combined with MRI fusion software allow us to do the focal therapy. And that is very interesting because it reduces the side effect, reduces the treatment time. You can retreat the patient, and patients have absolute high in confidence in the treatment.
Got it. From your resume, we can see magnificent career transitions, for example, from ultrasound engineer to biological and clinical medical scientist, and then to the founder of a company and chief scientific officer of Sonacare Medical. Could you talk a bit about the reason behind these transitions? What do you think, and how did that happen?
Well, the earlier transitions, what you mentioned from the engineering to a scientist, that took place under Professor Fry, where I learned how to do the science, how to do the experiment, and how to collect the data and present it to the rest of the world. Thereafter, when we developed the Sonoblade, then we knew this device has to reach out to the public, into the clinic, and that required commercialization. We were not very successful in the early days of commercializing. However, the opportunity came that we can form a company in Indianapolis, and my idea was still somebody else to run the company called Focus Surgery. However, that didn't work out, and my wife said, why could you not run the company? You become the president and the CEO. So the most significant thing was my wife's help, support, and encouragement. That gave me the energy and the trust in myself to start Focus Surgery. And in addition to that, there is another gentleman who helped us a lot, very, very much. His name is Mr. Takai. He's the president and owner of THS in Japan. He came to Indianapolis, worked with me, and said, Naren, you become the president, you run the company, I trust you. So that was an important part. So I have my wife's support, I have a partner who believes in me, and I have a small number of good people who wanted to work with me.
You also mentioned the chancellor or president of the university.
Yes, our university, the company was run at Indiana University School of Medicine for 1.5 years under the Department of Physiology and Biophysics. The chairman of that department became the chairman of Focus Surgery for a short time. The chancellor also helped me, said, Naren, anything you need from the university side, we will help you to make this company successful.
Which is harder, being a scientist or a businessman?
Both the things are same, basically. You have to work hard. You have to really have some sort of a vision where you want to go. You have to trust yourself. And in order to be successful, you just have to have lots of good people who help you.
Looking back at your career, what do you think is the most important contribution to the world?
I think helping people, I would use that word, doing good for the people. And,
By
well, reduce the pain is the most important thing. So when we see the radical surgeries and then the follow-ups are not that good, can we come up with something that can help the people and maintain their quality of life? So that is the purpose in life.
your life goal is do good for humanity. Does deepening and promoting therapeutic ultrasound technology help you achieve this goal?
Yes, I think so, because I think if you look at the focused ultrasound, the therapeutic ultrasound, so far, as far as we know, has the most minimum side effect. And that's what we want to do. We want to reduce the cost. We want to get this treatment available to as many people as possible. So that allows us to meet that goal.
Dr. Naren, could you introduce about the applications for research at your lab?
We have few ongoing research right now. One is using the stem cell and low intensity focused ultrasound called the LOFU that has already gone to a minimal clinical trial and shown some good results. The second application we are looking at, where we are going through the FDA right now, is called the varicose vein malformation. To treat the venous malformation, there are lots of veins that have not functioning properly. And we are working with a doctor to pursue the clinical trial in the recent months. We are also looking at advanced stages of treating the rectal tumor. We already have some examples that were treated at one example, one patient treated with Sonablate 500. Now we are getting ready to do more treatment of rectal cancer. The other will be the early detection of the breast and more future applications such as that combines very, very good imaging, molecular markers, and then do the treatment using focused ultrasound. So there are a number of ongoing projects. Mainly, we wanted to stay focused right now using the Sonablate device for the prostate.
Since you are now here in China, so what's your prospect of some future collaborations between the two sides?
Fantastic. What I see here is that there's a lot of enthusiasm. There are lots of young people working, and most probably our collaboration will increase exponentially. And we will be able to bring our vision together on many different applications, working with the hospitals, working with the clinicians and the doctors all around here.
If I invite you to use a few keywords to describe your life so far, what would those words be?
Simple, imagination, hard work, trust people, and thank many, many people for this journey.
One more question. So do you think that the artificial intelligence will help improve the technology in the future? I mean, the HIFU technology and improve the Sonablate HIFU device?
Absolutely. We already approached this many years back of bringing the previous knowledge to help the present day. So if you have the data collected from all these patients, you can utilize that to help guide the future patient treatment. So AI is a buzzword right now, but yes, artificial intelligence will be tremendously helpful in improving the Sonablate. For that reason, I think all focused ultrasound devices or other technique will improve. There are already published papers that are showing the interest to make use of AI using Sonablate.
My last question is about the current collaboration between Sonablate Corporation as well as some key hospitals or educational institutes around the world. Could you introduce a bit about that?
We always worked with major universities. Even after starting focused surgery, we had close to 22 collaborations with research scientists, medical doctors, all around the world basically. We work with Japan, we work in England, we work in the United States in major universities. So having done that, I think there's a tremendous potential to collaborate over here. Our companies and with the institutions, those were going to spend some time with us, and we will have many good progressive projects to work with them.
So a few questions earlier, I said about the population is aging all the world, especially major cities in Shanghai. So as far as I know that men reach a certain age, they can easily get BPH, right? What's the approximate percentage of that in the States, and how can Sonablate HIFU help to solve their problem?
Yeah, you are right. As the man ages, there is a prostate gland goes through the different transformation, and the gland grows bigger, and it has tremendous side effects. So the aging population will very much benefit from this treatment. It will be an outpatient treatment. It is an outpatient treatment, and that will help this patient population. It doesn't require blood transfusion, doesn't require incision, does not require to stay in the hospital. It will reduce the chances of infection, for example. So all of these things will help the aging population.
Thank you, Dr. Naren. I think these are
Just
all
call
the
me Naren.
questions.
Thank you.
Thank you.
Thank you very much.